What if your body has actually been giving you warning signs long before a stroke happens, but you never realized it? Because the truth is, a stroke often comes silently, only through small signals that are often ignored, like sudden dizziness, slight numbness in the face, sudden slurred speech for a moment, or unexplained weakness in the body. And what's really scary is many people only realize it after the stroke has already happened, when the damage cannot be fully reversed. So the question is, can you recognize these warning signs early before it's too late? Stay tuned until the end, because in this video, I will explain some early warning signs of stroke that are often ignored by many people, even though they could be important signals from the body. Before we continue, support this channel by clicking like and subscribe so I can keep sharing important health information for you and your family. And try answering in the comments, have you or your family ever experienced strange symptoms before a stroke happened? And don't forget to share this video with your loved ones, because this information might help prevent a stroke in someone you care about. Before a major stroke happens, some people experience something called a mini-stroke, also known as a TIA. TIA stands for Transient Ischemic Attack, and even though the word mini sounds harmless, it should never be taken lightly. Because a TIA is often the body's emergency warning signal that something dangerous may already be happening inside the brain. A TIA happens when blood flow to part of the brain becomes temporarily blocked. The brain depends on oxygen-rich blood every second, and when that blood flow is interrupted, even briefly, the brain can start showing warning symptoms immediately. A person may suddenly feel weak, confused, dizzy, or unable to speak clearly. Some people notice numbness in the face or weakness in one arm. Others suddenly lose balance or experience blurry vision. The frightening part is, these symptoms often disappear quickly, sometimes in just a few minutes. And because the symptoms fade away, many people make a dangerous mistake. They ignore it. They say things like, "I feel normal now. It was probably stress. Maybe I was just tired." But doctors warn that a TIA should be treated like a medical emergency. Because in many cases, a major stroke may happen shortly afterward, sometimes within hours, sometimes within days. In fact, health experts say that a TIA can be one of the strongest warning signs that the risk of a serious stroke is extremely high. And unlike a TIA, a major stroke can cause permanent brain damage, paralysis, speech problems, memory loss, or even death. That is why early recognition matters so much. The faster someone recognizes the warning signs and gets medical help, the greater the chance of preventing a devastating stroke. Never ignore sudden symptoms, even if they disappear, because sometimes the body gives a warning first before something far more serious happens.
One of the most common warning signs of a stroke is sudden weakness on one side of the face. At first, it may seem small. Maybe the smile suddenly looks uneven. One side of the mouth may droop downward, or one eyelid may appear lower than the other. Sometimes the person doesn't even realize it themselves. Instead, family members, friends, or coworkers notice it first. They may say, "Why does your face look different? Are you okay? Why is your smile uneven?" And this is important because stroke symptoms often appear suddenly, not gradually over weeks or months. One moment, everything seems normal, and the next moment, part of the face becomes weak or numb. Some people also describe a strange feeling, like their face suddenly feels heavy, tight, or difficult to control. They may struggle to smile properly, drink water without spilling, or move one side of the mouth normally. In some cases, the numbness only lasts a few minutes and then disappears, but that does not mean the danger is gone. Doctors warn that temporary facial drooping can be a serious warning sign that blood flow to the brain has been interrupted, and if ignored, a larger stroke may happen later, especially if facial drooping appears together with arm weakness, slurred speech, confusion, or dizziness. That combination can signal a medical emergency. This is why doctors recommend a simple test. Ask the person to smile. If one side of the face does not move normally or the smile appears crooked, seek emergency help immediately. because when it comes to stroke, acting quickly can save brain function and may even save a life. Another major warning sign of a stroke is sudden weakness or numbness, usually affecting one side of the body. This symptom can appear very quickly, sometimes without any warning at all. A person may notice that one arm feels unusually heavy, weak, or difficult to control. Simple actions become strangely hard. They may struggle to lift one arm, hold a cup, button a shirt, or grip everyday objects properly. Sometimes things begin falling from their hand without understanding why. Others may suddenly feel weakness in one leg. Walking becomes unstable, the body feels off balance, or one leg may start dragging slightly while walking. Some people describe it as feeling like their arm or leg fell asleep, but the sensation feels more intense or appears very suddenly. In many cases, the numbness only affects one side, for example, the left arm and left leg, or the right side of the body. And that detail is extremely important because stroke symptoms often affect only one side, depending on which part of the brain is losing blood flow. The scary part is, these symptoms may disappear temporarily. After a few minutes, the person may feel normal again. And because the weakness goes away, many people ignore it. But doctors warn that even temporary weakness can be a serious danger sign, especially when it appears suddenly without a clear explanation. It may be the brain's warning signal that a larger stroke could happen soon. In more severe cases, the weakness can become paralysis. A person may lose the ability to move an arm, stand properly, or walk independently. That is why sudden weakness should never be ignored, especially if it happens together with facial drooping, speech problems, dizziness, or confusion. If someone suddenly cannot raise one arm evenly or begins losing strength on one side of the body, seek emergency medical help immediately, because during a stroke, every second matters, and fast treatment can greatly reduce brain damage.
Pay very close attention to sudden changes in speech, because this is one of the strongest warning signs of a stroke. A person may suddenly sound different. Their speech may become unclear, slow, or difficult to understand. Words may come out slurred, as if the tongue is not working properly. In some cases, the person may try to speak normally, but the sentences become broken, confusing, or don't make sense to others. Even simple words can become hard to pronounce. For example, they may struggle to say their own name or repeat a basic sentence correctly. At the same time, they may also appear confused mentally. They might not understand what others are saying or respond in a way that doesn't match the conversation. Some people may suddenly appear disoriented, like they don't know where they are, what time it is, or what is happening around them. A very important warning sign is this: the person knows what they want to say, but they cannot express it properly. It feels like the brain is locked and the words just won't come out correctly. This happens because stroke can affect the parts of the brain responsible for language and communication. When blood flow is reduced or blocked, those brain functions begin to fail quickly. And just like other stroke symptoms, this can appear suddenly, without warning. It may last only a few minutes and then seem to improve, but even if it disappears, it should never be ignored. Doctors warn that temporary speech problems can be a sign of a mini-stroke, or TIA, which may be followed by a more serious stroke later, especially if slurred speech happens together with facial drooping, arm weakness, loss of balance, or confusion. That combination is extremely dangerous. If someone suddenly cannot speak clearly or struggles to understand simple communication, treat it as a medical emergency immediately, because when it comes to stroke, delayed action can lead to permanent brain damage, and fast response can make a life-changing difference.
Pay very close attention to sudden changes in speech, because this is one of the strongest warning signs of a stroke. A person may suddenly sound different. Their speech may become unclear, slow, or difficult to understand. Words may come out slurred, as if the tongue is not working properly. In some cases, the person may try to speak normally, but the sentences become broken, confusing, or don't make sense to others. Even simple words can become hard to pronounce. For example, they may struggle to say their own name or repeat a basic sentence correctly. At the same time, they may also appear confused mentally. They might not understand what others are saying or respond in a way that doesn't match the conversation. Some people may suddenly seem disoriented, like they don't know where they are, what time it is, or what is happening around them. A very important warning sign is this. The person knows what they want to say, but they cannot express it properly. It feels like the brain is locked and the words just won't come out correctly. This happens because stroke can affect the parts of the brain responsible for language and communication. When blood flow is reduced or blocked, those brain functions begin to fail quickly. And just like other stroke symptoms, this can appear suddenly, without warning. It may last only a few minutes and then seem to improve. But even if it disappears, it should never be ignored. Doctors warn that temporary speech problems can be a sign of a mini-stroke, or TIA, which may be followed by a more serious stroke later, especially if slurred speech happens together with facial drooping, arm weakness, loss of balance, or confusion. That combination is extremely dangerous. If someone suddenly cannot speak clearly or struggles to understand simple communication, treat it as a medical emergency immediately. Because when it comes to stroke, delayed action can lead to permanent brain damage, and fast response can make a life-changing difference.
Sudden vision problems. Stroke doesn't only affect movement or speech, it can also directly impact the eyes and vision. One of the important warning signs is a sudden change in how a person sees. This can happen without any gradual decline. It appears suddenly and feels unusual or alarming. Some people may experience blurred vision, where everything suddenly looks unclear, foggy, or out of focus. Others may see double vision, where a single object appears as two images overlapping, making it difficult to read, walk, or even recognize faces properly. In more serious cases, a person may suddenly lose vision in one eye completely. It may feel like a dark curtain has been pulled over part of their sight, or like one side of their visual field has disappeared. This can happen because a stroke may reduce or block blood flow to the parts of the brain that control vision, or in some cases, affect the blood vessels supplying the eyes directly. What makes this symptom especially dangerous is how unpredictable it can be. Vision problems may appear suddenly, last for a few minutes, and then disappear again. Because the eyesight returns to normal, many people assume the problem is gone, but doctors strongly warn that temporary vision changes are not harmless. They can be a serious warning sign of a transient ischemic attack, or TIA, which may be followed by a major stroke later. This is why sudden visual disturbances should never be ignored, even if they only last a short time, especially when they occur together with other symptoms like weakness on one side of the body, slurred speech, dizziness, or confusion. If someone suddenly experiences vision loss, double vision, or unusual blurring that appears out of nowhere, it should be treated as a medical emergency immediately. Because when it comes to stroke, vision changes are often the brain's early alarm system, warning that something serious may already be happening inside the body. A sudden, extremely severe headache can sometimes be a critical warning sign of a serious medical emergency, including stroke. This is not the same as a normal headache, or a headache caused by stress, lack of sleep, or dehydration. It often appears out of nowhere and reaches maximum intensity very quickly. Many people describe it as a completely different type of pain, something they have never felt before in their life. A common description from patients is the worst headache of my life. This type of headache can feel explosive, sharp, or overwhelming, and it may stop the person from doing any normal activity. In some stroke-related cases, this sudden pain can happen because of bleeding in the brain or a sudden disruption of blood flow. What makes it more concerning is how it often comes with other symptoms. For example, nausea or vomiting without clear cause, sudden confusion or difficulty thinking, or weakness in the face, arm, or leg. Some people may also feel dizzy, disoriented, or unusually sensitive to light and sound. When these symptoms appear together, it becomes a major red flag that something serious is happening in the brain. Unlike typical headaches that develop slowly, this type of headache is sudden and intense from the beginning. And even if the pain slightly improves after a short time, the underlying cause can still be dangerous. Doctors strongly warn that a sudden, severe headache should never be ignored, especially if it feels unusual compared to previous headaches, because in some cases, it can be an early sign of stroke or brain hemorrhage, both of which require immediate emergency treatment. If someone suddenly experiences a severe, unusual headache, especially combined with weakness, confusion, or speech problems, it should be treated as a medical emergency right away. Because when it comes to brain health, delaying action can lead to irreversible damage, while fast response can save both brain function and life.
Doctors around the world use a very simple but powerful method called FAST to quickly recognize the early signs of a stroke, because stroke is a medical emergency and every second matters. Face drooping. The first step is to check the face. Ask the person to smile. If one side of the face looks uneven or one side is drooping, this is a serious warning sign. The smile may look crooked or one side of the mouth may not move properly. Even small changes in facial movement can indicate that the brain is not functioning normally. Arm weakness. Next, check the arms. Ask the person to raise both arms at the same time. If one arm slowly drops or cannot be lifted properly, this may indicate sudden weakness on one side of the body. Sometimes the person doesn't even realize it until they try to move both arms together. This simple test can reveal early brain damage caused by reduced blood flow. Speech problems. Then observe how the person speaks. Ask them to repeat a simple sentence. If their speech sounds strange, slurred, slow, or difficult to understand, this is a strong warning sign. In some cases, the person may know what they want to say but cannot express it clearly. This happens because stroke affects the brain areas responsible for language and communication. Time is critical. The final step is the most important. Time is critical. If any of these signs appear, do not wait. Do not observe longer, or do not assume it will go away. Call emergency services immediately, because during a stroke, brain cells begin to die within minutes. The longer the delay, the more permanent damage can occur. Why FAST is so important? A stroke is extremely time-sensitive. Every minute without treatment means more brain cells are lost. This can affect movement, speech, memory, and even survival. But if treatment is given quickly, the chances of recovery increase significantly. Some patients can fully recover if they receive medical help fast enough. Remember this simple rule: face, arms, speech, time. FAST is not just a memory trick, it is a life-saving tool, because recognizing a stroke early can make the difference between full recovery or permanent disability, and in many cases, it can save a life.
Many people survive strokes because someone recognized the warning signs early. So please, do not ignore sudden changes in the body. And don't keep this information to yourself. Share this video with your parents, friends, and loved ones, because one piece of knowledge could save a life someday. If you found this video helpful, subscribe to the channel, like this video, and comment below. Warning signs matter. Stay safe and take care of your health.